Hey, are you a business owner, entrepreneur, or professional? If so, we want you to apply to be a featured guest on our show. My name is Adam Torres, and I host the Mission Matters series of podcasts. I've recorded over 3,000 episodes, and we are just getting started. How do you know if you'd be a good guest to be on the show? Well, only one way to find out, and that's to apply, but I'm going to let you in on a little secret. We want guests that have a story to tell, guests with a brand, a product, or a service that can benefit my audience of listeners. If this sounds like you, go to missionmatters.com and click on Be Our Guest to apply. I'd love to talk to you and get to know more about your story. Again, head on over to missionmatters.com and click on Be Our Guest to apply. All right, now let's get into the show. Hey, I'd like to welcome you to another episode of the Mission Matters Innovation Podcast, your source for all things innovation. My name is Adam Torres. You can follow me on Instagram at AskAdamFords to keep up with my book releases, book tour schedule, signings, all that other good stuff. Always love to connect you there. And as always, if you'd like to apply to become a co-author of one of my upcoming books, just head on over to the website, missionmatters.com, and click on Become an Author to apply. All right, so today I have Gary Austin on the line, and he's a CEO over at OneCare LLC. Gary, welcome to the show.
Thank you, Adam. It's a pleasure to be here.
So great topic for today. We will talk about making the home a care center and the family a care team. I think very relevant topic and for the times we're living in today. Maybe just get us kicked off, Gary. Tell us a little bit more about what you're doing over at OneCare.
Thank you, Adam. OneCare has developed a enterprise platform to make the home a care center and to train and certify the family and the patient in the home and certify them for managing the care that happens there. 90+% of all care is actually not delivered in a hospital or in a doctor's office. It's delivered at home. Mm-hmm. And this past year with the COVID-19 pandemic, even if you wanted to go to the hospital or the doctor's office, you weren't not able to. So patients were being sent home, and the home is not ready to be a care center. And so solutions that provide the tools and the training and the connectivity and the certification so that the patient is certified for the self-care and the family is certified for the care that happens there is a critical need. 60% of all healthcare costs happen as a result of a preventable episode of care, and those happen primarily in the home. So it's a big deal, and this past year we saw a radical shift in the direction of the home, but the home wasn't ready. So what we've developed is a platform to address that.
Man, that's great. And let's stick on the healthcare topic a little longer here. So what do you see as some of the biggest, and again, only so much we can do in a 10, 15-minute long podcast episode, but what do you see as some of the big challenges that are solvable in healthcare? When
a patient is admitted to the hospital for a new condition, they find out in that episode they have a new diagnosis. They're now discovered that they're a type 2 diabetic or they have a heart condition. Behaviors have to change, and the patient has to learn new things. Not doing a good job with that is a crushing thing for health for several reasons. One, the patient 20% of the time is going to be readmitted for the very same thing they got admitted to the first time. Wow. Every time you get admitted to the hospital, 20% of the patients get a hospital-induced disease or infection. So you don't want to go to the hospital, and you certainly don't want to get readmitted. Mm-hmm. The reasons for that are the patients and the family are not ready. They're not clinically trained. They don't have the tools to do this job in the home with excellence. And educating, training, and certifying the family and giving them the right tools also provides value for the people that manage that patient. So you can diagnose perfectly and treat and prescribe what the patient needs to do, but the patient ultimately is going to go home, and they're going to have to do this and be able to do it, successfully and effectively in the home environment. And but the doctor loses sight once they go home, and not knowing what's happening in the home when a new issue pops up, it's hard to know what to do to fix it. You have to know that the patient's perfectly following your rules, your orders, to know if you prescribe the right thing in the first place. And if they are doing that and you can prove it, then the care plan needs to change. And not knowing is the problem. And so we're bringing in the light of what's happening there and the documentation to prove that to the doctor so that they can do a better job of managing the patient. But because we're training and certifying the patient, we also give the doctor a better patient in the process. So a more adherent patient is a better patient.
Yeah, that makes total sense. So I could see how it benefits the patients, their families, and even the doctors in this case, as you just explained. Like, what effect does this have on the employers and the insurance payers? I mean, all the other things that are in this healthcare supply chain, if you will. Like, how does that affect the rest of the system?
Well, if outcomes improve and if episodes of care are reduced, patient health is better. If you're looking at it from the perspective of the insurance payer or the employer, these are the insureds. So the insured is going to have better health. They're going to be more knowledgeable. They're going to know what they should be doing, and they're going to also know what they should not be doing. If something happens, they'll know what to do to get their vital signs back to normal. And all these things are beneficial to the insurance payers and employers. The employee would miss fewer days, have better health outcomes, lower cost. But also, because of the data we provide, we have something called an adherence score. And the adherence score tracks what percentage of the things your doctor prescribed for you to do every day did you actually complete. Employers and insurance payers can use that score to incentivize those employees for that behavior to produce those high adherence scores through deposits in a savings account. An employer or payer could offer the employee $100 a month for that score, and whatever percent of that they get that many dollars in their account, things like that. So it puts everybody really in a place where they're helping each other to achieve the goal of better health at lower cost.
Man, I love when I hear companies creating these win-win-win scenarios. I mean, the insurance company wins, the patients win, the doctors win, the families win. There's better health, better quality of living. I mean, just any way you slice this one, there's a lot of benefits to be had. So, big fan of what you're doing, and obviously filling the need in this crucial time where a lot of things are changing in the world. And as you mentioned, like, you couldn't get into a hospital if you wanted to at one point, and for people that are in that situation, they need to start thinking about some of these things if they already haven't, and figuring that out. And then just even the quality of life that people can have of being able to be at home more. I mean, there's can you talk on that a little bit more and kind of what in your experience you've seen and how this changes the day-to-day lives of people?
Sure. Being a primary caregiver for a sick person with a complicated health issue is one of the most stressful things in the world. In fact, they compared it to the stress level that an active duty soldier has in combat.
Wow.
You're always on edge because you're always on demand, and because in combat things can be very uncertain, but so can healthcare crises. And if you're not adequately trained, it's a very stressful situation. We've had cases where people have received good professional care. One specific example, a lady, 85 years old, when she got on OneCare, was legally blind since she was in her 30s, had stage 4 congestive heart failure in the prior year under the care of a national nursing organization, she was hospitalized every month, and some months more than once, for her congestive heart failure episodes, costing over $1 million in the medical expenses. Put her on OneCare, got her trained and certified and connected with her family members, and messaging her on time, every time, all day, every day, for things she was supposed to do, and keeping her adherent to those things. She's been on the platform 2 years, and she was not admitted a single time for a congestive heart failure episode since she's been on OneCare. So we've saved the insurance company more than $1 million, and all the misery that she experienced the prior year from more than 12 hospitalizations for congestive heart failure. So these are the kinds of things that are possible. It's an extreme example, but that is the reality of what can be done when you make the home a care center and the family a care team.
No, I got it, and that's exactly what I wanted from you. I wanted a real example that we could wrap our heads around, because I know that it's a big deal what you're doing, and I know that that you're affecting many lives with this. So that and that's why I'm happy to bring this story to my audience also. So Gary, first off, I'll have to say it's been a pleasure having you on the show, and I'd like to give you the opportunity to leave. If somebody's listening to this right now, and if they want to learn more about OneCare and what you're doing, I mean, what's the best way for my audience to connect and follow up?
Best way is to email us at info@onecare.me, and that's ONECARE, onecare.me, and that's ME, like Mary Edward.
Fantastic. Well, Gary, really appreciate you coming on the show today and sharing more about all the great work you're doing over at OneCare and how you're really affecting lives out there. So thank you for that. And to the audience, as always, thank you for tuning in. Hope you got a lot of value out of this. Hope you learned a lot. I sure did. And if you did, don't forget, hit that subscribe button. We'd love for you to be a return listener, a visitor, a viewer, whatever you want to say. If you're watching us on YouTube, leave us some comments. Always like to connect with our audience there. And Gary, thanks again for coming on the show. It's been a pleasure.
Thank you, Adam. It's been a pleasure for me.